Okay, for tonight, see guys, we're discussing England's system for caring for dying people in England. Risk being overwhelmed. Captures a sobering warning from the charity Marie Curie, which has sounded the alarm over the fragility and under resourcing of England's end of life care infrastructure, escalating demand, and demographic shifts. England is facing a demographic tidal wave. Over 5 million people are projected to require end of life support within the next decade. This surge is driven by an aging population, and rising chronic and rising rates of chronic and complex conditions. As more people live longer with multiple health issues, the demand for palliative care or palliative and hospice care is intensifying beyond what current systems can handle. Hospices under financial siege. Specialist services, particularly hospices, are grasping are grappling with skyrocketing cost, inflation, staffing shortages, and energy bills. Energy bills are squeezing budgets, forcing many providers to cut back on staff, reduce services, or even face closure. These financial pressures are not just operational, they directly affect the quality and availability of care for people in their final months and days. Policy vacuum and systematic neglect. Marie Curie's open letter to wise screening or streeting, the UK's shadow health secretary, criticizes the government's failure to develop a coherent national strategy for end of life care. The charity highlights glaring inequities in access with some regions and communities, especially those already marginalized, facing severe gaps in service provision without a national action plan. The system remains fragmented, reactive, and vulnerable to collapse. Call for sustainable reform. Marie Curie is urgently urging policymakers to establish a long-term, equitable funding model that ensures all people, regardless of geography or um, societal economic status, can access high quality end of life care. This includes not only medical support, but also emotional, spiritual, and social care tailored to diverse needs. The charity emphasizes that dying well should be a universal right, not a postcode lottery. Broader implications. This crisis isn't just about healthcare. It's about dignity, equity, and the values of society. When systems fail to support people at the end of life, it reflects deeper structural issues in how we care, how we prioritize, funded, and delivered. Uh, the warning from Marie Curie is a call to reimagine end of life care as a public health imperative, demanding investment, planning, and compassion at scale. Okay, in short, England's end of life care system is a crossroads without urgent intervention. It risks being overwhelmed, leaving millions without the support they need during one of life's most vulnerable stages. Okay, guys, the reason why I did this show is to do a comparison for the US and England's end of life system. So I think that would be a good comparison. So with that being said, I will try to jump back on and do a D, and if I do, the D will be the US end of life system for us. Okay, so if I get a chance, I'll jump back on and do a D. For now, Gator Wellness, take care, folks.